Uh, Elizabeth ma'am, hello. Can you hear me? Hello. 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 Ma'am, I don't know. Okay, Vibha, you can stop the sharing. Okay. Elizabeth, ma'am, good evening, good afternoon. I think she's there. Vibha, can you hear me? Hello.
Sir, you're audible.
Okay, okay, okay. Hello. Okay, so we can. I think the live is still going on. We will start by sharp 5 minutes earlier. Okay, sharp time 4 p.m. Okay.
Ma'am is there.
Yeah, ma'am is there. Ma'am is not talking actually.
So my screen sharing is still on. No?
Yes, yes. Viva, I'm muting you. I will call you. I will message you. Okay. Fine. Hello. Hello, ma'am.
Hello.
Yes, good afternoon.
Hello, should I start to share my screen?
Yeah, yeah, you can start the screen, ma'am.
Yes, okay. I cannot put the how to do
Yeah, it's
this.
okay. It's okay.
It's
It's
okay,
yeah, the screen is visible. Very clear.
but it is better like this, no?
Yeah, yeah, it's better. You can maximize the screen. If you can
What?
continue in this way, na, no problem. Both ways are okay.
Okay, in this way I cannot see the chat, but uh,
The chat box we can you want an interactive session or a plain session, ma'am?
I excuse me, I don't understand. What was the question? If I
You need to see the chat box. If so, you can keep the screen
like
like
before?
you did previously. Okay.
Okay, but can I ask you that if there will be questions to tell me, because for me it's
Yeah,
more easier like this.
yeah. We will read out. Okay.
Okay, thank you.
Okay. We will start sharp 4. Okay.
Okay, thank you.
Okay. Thank you, ma'am. Okay.
Hi, ma'am.
Hi.
How are you?
Thank you. I'm fine.
Okay.
I was thinking how to start my video. Now I find.
Yeah, it was
So
easy in Zoom actually to join, no? And to
yes,
share
yes,
screen
it
also.
was. Yes, of course. I prepared my other laptop too in case that
Yeah,
something will. But so I am from two, but I hope that everything will be all right.
yeah. Last time it was so messy during screen sharing and all.
Oh, oh yes. And I am not so good in this technical part, and I was a little bit.
That platform is quite hidden for people. You know, so many people are. Even I was not so much handy with that platform actually.
Yes. But thanks to your help and your colleague help, everything was fine.
Yeah, exactly.
So I hope that now it will be like in the same.
Exactly. It will be definitely.
Okay.
Patient.
Can we start the session with her?
Yes, sir. You can.
So, good afternoon, everyone. Welcome to another episode of Excel webinar series. Before we move to the session, a silent prayer. Thank you. Excel has been continuing since 3 months, and we have reduced the webinars to weekend days. So, today we have a very special faculty from Romania, and today's session will be worth uh, for all of you. And I welcome Dr. Vibha Mevada to introduce the faculty. Thank you.
Thank you, Dr. Deepu. Good evening, all of you. As we all know, today's our speaker is Dr. Erzebet Turos, ma'am, with us. I just want to say in short about ma'am. So, ma'am is a MD homeopath, and she did ISCH diploma from Greece. Ma'am did a master's certificate course from the Other Song International Academy of Advanced Homeopathy. Ma'am is a specialist in family medicine, also master in psychology, counseling, and psychotherapy. She is an executive committee member of Afghanistan Homeopathic Medical Association and member of Homeopathic World Community. Ma'am started first. She learned homeopathy in Bruchard in 2011 to 13, followed by e-learning course with Professor George Whittle Cost from International Academy of Classical Homeopathy. It was a diploma when she completed in 2016. In the same year, ma'am met Dr. Rajan Sankaran and the sensation method. And between 2016 and 18, she followed many online courses about repertory and mentoring at the Othersong International Academy of Advanced Homeopathy, Mumbai. In 2018, she participated on a master course with Dr. Rajan Sankaran, and in this year also on my week with Rajan. Ma'am learned a lot from Dr. Gaurang, and whom she considered also her mentor. So, ma'am graduated from the University of Medicine and Pharmacy from Cluj-Napoca and worked as a physician in the psychiatric hospital for chronic mental ill patients for 20 years and innovating the treatment through introducing occupational therapy and art therapy. The highest recognition of ma'am's work happened when she is nominated for Nobel Prize in 2005. She always had a desire to understand the human psyche as deep as possible, and she wanted to understand the dynamics of human relationship. That is why, in parallel with her work, she is always studies something. So she did a training course in family therapy between 2019 and 1999 and 2001. In 2005 to 2007, she followed a master in psychological counseling and psychotherapy. In her dissertation, she did a research about perception of the disease and hospitalization in leukemia patients. In 2007, she co-founded the Alternative Association of Leukemia Patients. Between 2009 and 2016, she taught geriatrics and palliative care in the Sanitary High School for Nurses. And between 1996 and 2002, she did charitable consultation as a general practitioner as the philanthropical humanitarian foundation of Saint Mary Church. In 2002 and 3, she did family therapy consultation within a phrase project for the prevention of child abuse and emotional neglect. Child Talk, Who Listened to Them, World Vision Foundation, Cluj-Napoca. She studied also psychosomatic medicine, New German medicine, germotherapy, Suzler's salt, bachelor flower remedies, and astrology. Ma'am practices since last 7 years and having experience in behavioral problems in children, anxiety, panic attacks, OCD, depression, PCOD, climatic related problems, thyroid diseases, migraine, allergy, asthma, aneurysm, and many more. She also had many patient awareness workshops, presentations about the effectiveness of homeopathy in international conferences, includes at alternative therapy conferences, health and lifestyle symposiums. She have spoke also in radio and television repeatedly. So she shared some of his cases, some of her cases through Homeopathy journals, and reviewed Dr. Goran's book, like Dr. Decoding Mental Rubrics and Materia Medica of Nosot and Sarcodes. She appreciated very much his movement between us homeopaths and sharing knowledge and learning from each other for taking the practice of homeopathy to a new level. So it's a pleasure to have you, ma'am, on IHMA today. So you are welcome and thank you so much.
Thank you very much, Dr. Viba. I feel very honored and thank you very much for this invitation. For me, as a European homeopath, it is really a very great honor to be invited by you to speak in front of so many very good Indian homeopaths, because as everybody knows, India is the number one when it comes about homeopathy. And I would like, I am very grateful for my teachers and mentors. As you presented, I have learned homeopathy first in Romania, after that from Professor George Vitulkas. And since 2016, I learned a lot from Dr. Rajan Shankaran and the different homeopaths from the other Sang Academy. And especially from Dr. Gaurang Gaikwad, whom I consider also my mentor. So I am very grateful for all of them. And because I have learned from this famous Indian homeopaths, I consider that it's really a great honor for me to be invited by you as Indian homeopath to speak in front of you. So thank you very much. Today, I will speak about this topic, that how homeopathy and art therapy can help patients to overcome alcohol addiction. I cannot move my slide. Wow, why?
Can you
To put back?
Yeah, put back.
Just a minute.
If there is any problem, you can stop the screen sharing. Okay, no problem.
I don't know why I cannot manage to move the slide like last time.
It's a problem with the Zoom. You can stop the screen sharing now. Okay.
Now to stop the share. Okay.
Then
and now to
restart.
share again.
Yeah.
Okay, but it is still on that slide and then I cannot move. Why?
Okay, ma'am. You stop the screen share and leave the full screen in your laptop.
Hmm.
You are able to do now?
I don't know if I understood. What should I do? Just a minute. Oh. So to leave it? No.
Uh, can you leave the full screen in your laptop, ma'am?
Yes, this is what I don't know how to do.
Escape
I
button. You can put
escape. Yes, I put escape. Yeah, now.
it come to normal now.
Yes, but what happened? I don't know. Just
Right.
a minute.
Okay.
I think that I closed my PowerPoint. I have to open again.
Yes. Yes.
And now I try
Yes.
to open. It goes a little bit slow.
No problem, ma'am. No problem. It happens.
So, excuse me. It is really very unpleasant. Now you can see. Do you can see now?
You can
My
share screen share, ma'am. Can you?
now I have to share again. Yes.
Yes. Yes.
Okay, but how? Hmm. I don't know what.
You can share the screen, ma'am. No problem.
Yes. Okay. Can you see now?
Yeah, we can see now.
And
Okay.
should I let like this in this little format? I mean, not to make broader.
You can start from the next slide. If the problem keep coming up, we can do like this. Better you can keep it full screen, ma'am.
Okay. So here are the info about myself, but Dr. Viba already told about this. And now I will present you my topics. So I will speak a little bit about what is addiction. I will present you a tool called TRIPS2, which is a very useful tool to quick recognition of anxiety, depression, and alcohol disorder. In the next, I will speak about the homeopathic approach. I will present you a few rubrics related to different addictions from different repertories. In the next, I will speak about two cases of mine. I will present you two cases. And after that, I will speak a little bit about the benefits of art therapy and different techniques of art therapy. So is it okay if I let this like this to be sure that
I think we are able to see. No problem. If
yes,
but for
it
the
is okay, or is it too small?
it is too small actually. You can keep
Too
it.
small. Okay, I try again, but okay. Okay,
Oh,
now it is okay. So what is addiction? Uh, I will give a very simple definition that addiction is an uncontrollable urge or compulsion to engage in some specific activity despite being aware of the negative and harmful consequences to one's physical and emotional health and relationships. And when we speak about addiction, there can be very different, like person can be addicted to recreational drugs, alcohol, tobacco, gambling, sugar, caffeine, sex, food, work, or even to their partner. Now, what are the motivations for addictive behavior? Mainly, we can categorize, there are two categories, the desire for sensory pleasure. This is typical for young people, or the avoidance of pain or suffering. And when we speak about avoidance of pain or suffering, there are different roots of the addictions, like unfulfilled need for love and acceptance, the loneliness or isolation, the sense of culpability, the inner anguish, misunderstanding, family abandonment, unhappiness with themselves, feeling useless, inadequate, inferior, or incapable to act for themselves and the others. Now, for us as homeopaths, when a patient came to us with this problem of addiction, it can be difficult to recognize or to realize how serious the problem is. Because, for example, I have a patient who came to me because he's addicted for different drugs, but usually, or in most of the time, the patient who present this alcohol addiction, especially, they don't used to come to us as homeopaths because of their addiction. They came to us because some other physical problems. But while we take the case, we realize usually that there is a problem, that they have this problem of addiction. At least that's how it happened to me. The patients are not all the time very open to speak about uh, this addictive behavior of their, I mean, to recognize how much alcohol they used to drink or how often or things like that. And then as physicians, as homeopaths, I think that is very important to have something like a tool to can realize that in which category this addiction problem belong. So in this regard, I find very useful these trips, which is a training for interactive psychiatric screening, which in fact is an interview for use in non-psychiatric settings for the quick recognition of anxiety disorders, depression, and alcohol disorder. And this tool was elaborated in 2009 by Professor Heinz Kachnik. He is a professor of psychiatry at the Medical University of Wien, the director of Ludwig Boltzmann Institute for Social Psychiatry. And I was lucky enough to be between the few Romanian doctors who were trained directly by Professor Heinz Kachnik in 2009. And we had as task to train other doctors too about this very useful tool, as I said. Now let's see what is it about. So this is a short interview, and it is very helpful, as I said, because it can help us as homeopaths or as general practitioners or family physicians to recognize if a patient really have a problem with alcohol addiction or not, or if he has, how serious the problem is. So this tool helps us to differentiate between the following three problems. The first is the excessive alcohol use, which is not an ICD-10 diagnosis, is rather a screening category. And we can speak about excessive alcohol use when a person consumes more than 21 units of alcohol per week in a case of a man, or more than 14 units of alcohol per week in a case of a woman. The next is the harmful alcohol use, which is already an ICD diagnosis, having this code of F10.1. And in this situation, the patient presents physical and psychological harm due to excessive alcohol use. And the third one is the alcohol dependence. This is also an ICD-10 diagnosis, having this code of F10.2. And in this situation, there are already withdrawal symptoms. On the next page, this TRIPS has a few questions which we have to address to the patient to identify to which from the three categories he belongs. And here we have also a questionnaire, which is very important to say that this is a very short questionnaire, easy to apply for the patient. And on the same page, we have three different kind of questions marked with three different kind of colors. And why is it important? Because we have questions related to anxiety, questions related to depression, and questions related to the alcohol consumption. And this is very important because usually a person who have problem with alcohol the alcohol issue is not singular, as I presented in the root of the addiction, that these patients usually have also anxiety and or depression, and the consume of alcohol is only a consequence of the first issues. So that is why it is very important to identify if patient has also anxiety and depression. So, as I said, we can identify these three categories: the excessive alcohol consumption, which is a screening category; the harmful use of alcohol, where we have somatic impairments, psychological impairments due to excessive consume of alcohol; and we have the alcohol dependence syndrome with signs of withdrawal and signs of tolerance. Now, what does it mean, an alcohol unit? An alcohol unit means 330 milliliter beer, 250 milliliter wine, or 20 milliliter brandy. And now in the next, I would like to present you a study which was published by Franz Küsse in 2006 called Addiction, the Homeopathic Treatment of. And this is a very interesting study which started in May 1998 in a province of North Holland, where homeopathy has been part of the treatment in a regular clinic for addiction. 159 clients have been treated with homeopathy since 1998, and the results were in the same order, that about 70% of the patients reacted well. They were in a much better emotional and physical state and were clean when they left the clinic. The reason is that the combination of being aware of the underlying problem through consciousness and stimulus to the vital force through homeopathic remedy enforce each other and can really give permanent cure physically, emotionally, and mentally. Insight alone can sometimes bring real change, but in practice, it is seldom strong enough to take away the patterns of addiction. And now let's see what about homeopathic approach. As we know, homeopathy is based on some principles formulated by Samuel Hahnemann, and the two of the most important principles are, first is the individualization, which means that we treat the person, not the disease, and the second is the holism, which means that we take in consideration the totality of the symptoms on mental, emotional, and physical level, and also we take in consideration the causality and the life circumstances. So the homeopathic anamnesis is an exploratory about the mental emotional symptoms, including here the dreams, delusions, and fears, about the behavior, which we have from our observation and from heteroanamnestic data from relatives, about the exciting factors, and here we have the childhood traumas, the dynamics of family relationships and the relationships at work, and of course, we take in consideration also the pathology, affected organs, local symptoms, physical generals, and modalities. Now, just to illustrate, I want to show to you a few rubrics related to alcoholism from different repertories. For examples, from the repertory synthesis by Friedrich Schroens from the Radar 10, we have a few rubrics, as you can see here. In the broad rubric alcoholism, we have 149 remedies, but it is very interesting that we have very small rubrics like alcoholism from excitement, alcoholism after grief, or other very interesting also single remedy rubrics like alcoholism with irritability, alcoholism menses before, or even alcoholism after or during pregnancy. But we also have alcoholism from timidity, or this interesting rubric which I used in my first case, alcoholism with complaints of upper limbs. Also, we have rubrics related with withdrawal, alcoholism to support the withdrawal. As you can see, there are 14 remedies, remedies related to delirium tremens, or even a rubric about the family history of alcoholism. Of course, there are rubrics related to other addictions too, like tobacco addiction or desire for psychotropic drugs, or even we have rubrics related to bulimia or ailments from sexual excesses. From Clark repertory, we can see also different rubrics related to different addictions like coffee, condiments, spirituous, liqueurs. And here is interesting that we find remedies like nux vomica, lachesis, and opium. From the reliable repertory from synergic homeopathic software, we can find even many more rubrics and many remedies related to different addictions. Or from the Tarkas Kulkarni AIDS repertory, we can see that there is this rubric that addictive personality in, and there are 6 remedies like carcinosinum, lachesis, medorinum, nux vomica, opium, and tuya. Now I would like to present you my first case, which was a 62 years old man, divorced. He visited me last year in July, having as chief complaint the stiffness of left shoulder, but there was another problem of him, which was the inability to take a decision concerning his life. He was in a kind of middle life crisis. He didn't know what to do, which choice to do in his life. About his life circumstances, he was divorced, having a girlfriend in another state. And his main dilemma was to move or not to move there with this girlfriend. But his most intense symptoms was that he was very jealous on this girlfriend because she has their other friends, 2 men and also 2 mini pigs. So there were a lot of quarrel because of them. Because of the mini pigs especially, he considered that the girlfriend spent too much time with her friends and the mini pigs. So he feels cheated, although he was always very correct, as he said. He did not receive the visa, so he could not leave the country to go to visit this girlfriend. About his temperament, he was nervous, tense, irritable, used to anger easily, and he used to drink daily to reduce his tense, and swears a lot. That is what I talk at the beginning, that this kind of patient usually does not come to us because of their alcohol consumption. But if we take the case deep enough and in detail, then we find about this alcohol consumption. About his fears, he had the fear not to lose his girlfriend. He had fear in the dark when alone. He had fear from height, and he had also a strong fear from snakes. This is a very intense and spontaneous symptom because he told about this without being asked about snakes. And he had also fear from that. He cannot tolerate to be criticized, to being spoken what to do. He cannot tolerate being offended. He had a lot of problems at his workplace because of this, and he cannot tolerate gossip. He was also very suspicious, very strict with himself. He had many remorses, and when he was angry, he became auto-aggressive. He used to cut her face when was disappointed in love and beats his head against the wall. About his childhood, I find out that his parents divorced, and he was raised only by mother and grandparents very strictly. A very big ailment of him was that he never met his father. He said very sadly that he has got a toy once a year. So in this way, mother meant everything for him, and now, because she died, now he had many remorse after her death. Another very intense symptom of him was the sleeplessness. And he presented the dreams, repeated dreams, with fear of unsuccessful exams or aggression. He was sensitive on noise, but used to listen to loud rhythmic music. He liked fishing with friends. And another very peculiar symptom was that he did not like to be alone, but neither to be married. It came repeatedly in his case. He likes cold weather, but is sensible on air draft, especially the left side of his body. About his physical symptoms, he had the surgery on his left knee. Now he has presented this symptom on his right knee. Have sound senses and also this fidelity in tracing the picture of the disease. So now when I start to analyze his case from system approach point of view, it is very obvious that in this case, everywhere is this theme of me versus others. The others can be the girlfriend, the colleagues, all the time there is this issue of me versus other. So because of this and because of the other themes like aggressiveness, his auto-aggressivity, his intense jealousy, it is obvious that the remedy should belong to the animal kingdom. And now if we analyze further the case, taking in consideration his suspiciousness, his interior antagonism, not to, he didn't know what to do, to marry, not to marry, this feeling of being cheated, his intense fear of snakes, which came up spontaneously, his destructiveness, and he had also a big tattoo on his body. All these themes points to the reptile subclass. So his very intense symptoms were because of this, he came to me, the inability to take the decision concerning his life and his jealousy. But there was this other striking symptom that he used to drink to reduce his tense. He used to drink daily, and his auto-aggressiveness. And another, this very peculiar thing was related that he didn't knew what to do. He didn't like to be alone, but neither to be married. And now if I repertorized all these symptoms, taking in consideration these intense and peculiar symptoms of him, we can see that I take as first symptom here the ailments from being neglected by father, because this was a very peculiar characteristic of him. He detailed very much about his childhood, that how bad is that he never met his father after the divorce of his parents. And this is an interesting rubric because there are only 11 remedies, and lachesis is one of them. And why I speak about this, because I used many often this remedy, and in many cases where patients needed lachesis, I find this symptom of this how they perceived their childhood of being neglected. It does not mean in every case is that they were neglected, but it is the feeling how they perceived the situation. But in this case, he was really neglected because he never met his father after the divorce. I took also the other rubric, this alcoholism complaints with of upper limbs, which is also a very interesting rubric with just 4 remedies. And of course, I took in consideration the other symptoms like intolerance of contradiction, his destructiveness, his fear of death, fear of snakes, the forsaken feeling, and also this peculiarity to be irresolute to marry, or the idea of marriage seemed unendurable. Of course, I take in consideration the jealousy because this was very intense symptoms in his case, and the deeds of violence, rage leading to deeds of violence, his sexual desire, which was increased, and the desire for alcoholic drinks. So the remedy which covered all these symptoms was lachesis. And now if we read from the Materia Medica about lachesis, in reliable reverse repertory, we can find exactly this, that lachesis has this tendency to become addicted to alcohol. From the Mirelis thematic Materia Medica, we can read about this fact that irresolution to marry, the idea of marriage seemed unendurable, and also the irresolution, indecision to marry. So at the first control, which happened after 3 weeks, he felt much more calm. He did not need to drink alcohol. The sleep was better. The bad odor from the mouth had gone. His appetite increased. And finally, he took the decision concerning his life. The second case, which I would like to present to you, was a 69-year-old woman who visited me in 2 years back in August 2018. Her chief complaint was a suppurative varicose ulcer on left leg resistant to allopathic treatment. This was a very old ulcer on her left leg, which resisted each and every allopathic treatment. And this was the reason why she came to me. It is very important to speak a little bit about my observation when she entered the clinic. She had a very bizarre clothing, a long, dirty black dress, and a very intense makeup with a big black braid in her hair. This in this way, she somehow showed eccentric how she mourned. Because in our culture, usually people used to wear this black dress all over when they lost somebody, so when they mourn. But the way how she, at her age, how she was dressed and how she had this big black braid in her hair, it was somehow very eccentric. Now about her case history. 20 years before, her daughter, who was pregnant with the second child, it happened that she died in a car accident, which was, of course, a very big loss for her. And after that, she had to raise her first granddaughter of 9-year-old. So this was a very huge trauma for her, of course, a very big loss. And she had never recovered from the pain of loss. She cried a lot. She was sleeping in house surrounded with dogs. She could not communicate with anybody. 5 years after the death of her daughter, the varicose ulcer developed on her both legs. She also has high blood pressure, treated with allopathic medicines. And about her temperament, it was very interesting that after she told me about the death of her daughter, very abrupt, she came to speak to me about how optimistic she was before the tragedy, and in fact that she has a huge desire for amusement, because before she was a singer in a folkloric ensemble and she used to sing at parties, and now how much she missed those times. So it was very interesting, this polarity that of course, she had this big loss and she showed eccentrically how she mourned, but deep down in her soul, it was so huge, this desire for amusement, that she started to speak about this very long and detailed. She also told me that she played key roles. Her nickname was Fucking Bitch, and she had spoken a lot about this aspect. In a moment, she said that I'm mad because she lives with 12 cats now, but before she lived with 22 cats in the house. Just imagine. She likes also jewelry and talks about herself in a very laudative manner. She speaks a lot, jumping from one subject to another. She was really difficult to follow. She was very attached to her family members and was very materialistic. And she was also very secretive nature because she said that although she has this ulcer since 15 years, nobody saw her leg. And now she told me that, in fact, that is why she wear that long black dress, because she was so embarrassed uh, and she didn't want to show to people her pathology. She also cared for her mother many years because her mother suffered with dementia, and this for her was a drama because she had to change diapers and things like that, and that was the reason she said that she started to drink daily to can cope with her responsibilities. So again, as you can see here, the fact that she started to drink daily, it happened many years before, but for her this was not a big issue. I mean, not that this was the point why she came to me. From the heteroanamnestic data from her sister, I find out that she used to drink since many years daily at home. Her house is a whole mess with so many cats everywhere. She does not use to wash herself, never washed her feet, because she had this delusion that it's not good to put water on the ulcer. She had fears from snakes and snails and reptiles in general. And again, this was a very intense and spontaneous symptom because she told about this without being asked about snakes. And she presented also sleeplessness. Her sleep position was on right side. About her physical generals, she presented heat flashes. She was operated by uterine fibroids many years ago, but nobody from her family knows about her illness. So this reflects how secretive she was, because imagine to be operated by anything, and for example, her husband had no idea about this. She was also warm-blooded, ameliorated by cold, thirstless. She had desire for fat, cheese, eggs, and tomato. She had aversion for bread and potato. She presented urination frequent in the night, perspiration on the neck, and she does not tolerate anything around her neck. And now, if I analyze the case, it is like an iceberg, because the reason why she came to me was her physical pathology, which is on the top of the iceberg, the suppurative varicose ulcer of the left leg. But under this, there is her behavior, which practically was her coping mechanism, this drinking daily and having the 12 cats in her house. And under this, there are the roots of the pathology, which was the ailments from grief, her secretive nature, and the other side of the polarity, the desire for amusement. And now, if we want to know which kind of mayas should belong her remedy, it is obvious that it has to be a remedy which belongs to the syphilitic mayas, because of this destructiveness, which is manifested on the physical level through the ulcer, through the alcoholism. This is her auto-destructiveness. The big devastation because of the grief, and this kind of psychotic reaction of her having all these 12 cats in the house and her bizarre clothing. So now if I repertorize her symptoms, taking in consideration again the root of the problem, which was the ailments from grief, the other polarity of her um, uh, psyche, the desire for amusement, her loquacity, this very specific loquacity jumping from subject to subject. And you can see that this is a single remedy rubric. And also her dipsomania and fear of snakes. The remedy which cover all this is again lachesis. And if I make the sectorial repertorization of the physical general symptoms like throat, clothing aggravate, the tumor, the myoma of the uterus, and also this very typical aspect of her leg, of her ulcer, where again there is a single remedy rubric, extremities, ulcer, legs, chronic, indolent, flat with purple skin, small sores around ulcer, which has an uneven button, burning and bleeding even when lightly touched, and office, with this offensive discharge. And also her heat flashes, which is also very strong keynote of this remedy. The remedy is again lachesis. And here you have the photo about how her leg looked like when she came to me in 3rd August. And in just 5 weeks, as you can see here, the evolution was very good. But the other point, which so that is why I bring this case to you, that she stopped drinking. And the beauty of the homeopathy is really this, that when we find that remedy which covers practically all the pathology of the patient, starting from mental emotional problems related to her behavior, which was her coping mechanism in this situation, and also her physical pathology. So again, if we read the Materia Medica about lachesis from the reliable reverse repertory, we can read about these ailments from dipsomania, even the hereditary tendency for dipsomania. From the released thematic Materia Medica, we find exactly this rubric that lachesis has or can have these ailments from the death of a child. And from the Fata Materia Medica, we can read this aspect about how her ulcer looked like. And from the Murphy's Nature Materia Medica, we can read about lachesis that is indicated in alcoholism, as you can see here, in high blood pressure, because she had also the high blood pressure, in hot flashes, menopause, but also in ulcers of varicose veins. And now I came to the second part of my presentation, where I would like to speak a little bit about the role of the art therapy. As Dr. Viba told about myself, I worked before 20 years in psychiatry with chronic mental ill patients, and my contribution was that in 2003, I innovated the treatment of these patients through introducing the art therapy and occupational therapy in the treatment of chronic mental ill patients. And why I did this? Because when I started to work in this hospital, where we have a different pathology, we treated the patients with schizophrenia. We had also patients with dementia and a lot of patients with alcoholism, chronic alcoholism. I find very interesting somehow that these patients came there to be treated of their alcohol addiction, but because they had nothing to do in the whole day, they used to smoke a lot and to drink coffee the whole day. So they came with one addiction, and in the meantime, they became addicted also to caffeine and to tobacco. And I find that somehow this is not okay. And I was thinking what I should do, how can I, how could I help them not to smoke so much. And I realized that the single modality, how I would help them is to give to them something to do, a kind of occupational therapy. But there was a very difficult time. Uh, we worked there in very poor condition. We had no financial support for this, and so my intention was very good. But I really did not know how to realize this. But it is so beautiful, as Paulo Coelho had written, that the universe always help us to fight for our dreams, no matter how foolish they may be. Our dreams are our own, and only we can know the effort required to keep them alive. So uh, my dream and my wish and my intention was good, as was to help them. And it was absolutely beautiful how the universe helped me because in 2003, some German psychiatrists came and visited our hospital, and they were very impressed about the bad situation from that time from this hospital. And they support us morally and also financially. And in this way, I can start to realize my dream, and I can start to organize this beautiful activity. So I invite my colleague, who became my colleague, an art therapist, Poro Agnes, and with other two art therapists. In just 6 months, we open 3 different rooms for 3 different kind of activities where these patients can have this art therapeutic activities. And here you have a few from their works. I am very proud and I am very grateful that this initiative was very successful. And even now, when now I don't work anymore in this hospital, but this activity continuing even now. And I really feel that has a wonderful contribution to make the life of these patients better, and especially the quality of life. So how or why art therapy can help patients with addictions? And in fact, the answer that how exactly, in which way art therapy can be benefiting for this kind of patients, we can find in medical astrology. Because as Dr. Viba had said, I studied also astrology. So the main reason is here that the art and the addictions are the two polarities of the Neptune archetype. Because art allows to reach a modified state of consciousness, but in a constructive way. And in the same way, the addictions, they bring this modified state of consciousness, but this is happening through addiction in a destructive way. So that is why we can understand this through astrotherapy, because the astrotherapy means this vertical shifting of the symptoms. So it means that the point is that these patients, in their personality, they have this tendency to reach for this modified state of consciousness, but to take out their addiction, this has to be replaced with something which is constructive, and this is the art. And it was very interesting that in so many years I observed in Borsha that these patients who present different addiction, they are really very, very gifted, having this talent to paint, for example, or to play different music instrument, or so they have a very sensible soul. And yes, so the benefits of the art therapy are very multiple, because it allows the free expression of the emotions like anxiety, frustration, tension. Because as I told in the beginning of my presentation, the root of different addictions, in fact, are these: the anxiety, the different frustration, depression, because unfortunately, this kind of patients, they don't use to communicate very well. It allows also the nonverbal expression of the ideas. And in this way, because they do not know how to communicate their feelings, but through painting, through music, it helps them to allows to express their ideas. It also brings to the surface images from the subconscious, and as I said, it helps them to rediscover their own creativity. So finally, it is an artistic symbolic self-expression, and it also gives them the feeling of meaningful work, which bring them this sense of success. Because otherwise, these people, especially those who came in that hospital and had suffered with this chronic alcoholism or any other addiction, they had no anymore any success in their life. Uh, and through the sense of success, it helps also to regain and strengthen their self-esteem. It brings aesthetic experience, and in this way, it is a wonderful self-discovery method and a curative act in a cathartic sense. And through introducing the art therapy, the idea which drive me all the time was this formulated by Benjamin Disraeli, that the greatest good you can do for another is not just to share your riches, but to reveal to him his own. And in fact, through art therapy, this is exactly what I did there. And there were also other benefits, because to belong to an art therapy group, it bring also other benefits like the integration and group membership. Usually these patients who spend so many months or even years in this kind of hospital for chronic mental ill patients, they are very isolated in the society. They are also isolated usually from their family. The family does not accept them anymore. So that is why this kind of art therapy group, it is very good for them, for this feeling of reintegration. So the group is a supportive environment which facilitates the communication and relationship. And in a hospital, as I said before, where these kind of patients, they had nothing to do, I realized that the most harmful situation for a person is to do nothing. This is really illness. So but having this kind of activity through the occupational therapy, to the art therapy activity, it helped them to structure their day. And also, it helped the emotional maturation through accountability, because if you belong to a group, they may have their some little responsibilities. And through these little responsibilities, it helped the person to maturate emotionally. And of course, it increased the tolerance for frustration by developing self-control. Because again, if these patients usually they have also problem with their self-control, as we can see in the first case of mine, where he used to be aggressive and auto-aggressive, so they cannot control their impulsions. And if you belong to a group, you have to control yourself. Yes, so to all these things, This art therapy and the art therapy group contribute to the personal development, and finally it brings individual transformation, which facilitate the reintegration into society. The result or the success of this activity I presented in 2008 at the third National Congress of the Psychiatry in Bucharest. And after that, in 2012, in another conference about alcoholism. And finally, I would like just to tell about which are the different techniques of art therapy or social therapies which we practiced there. So there are visual art techniques like drawing, painting, modeling, collage, the folk art techniques, embroidery, knitting, wood carving, braiding twigs. There can be auditory kinesthetic techniques like music therapy, dance, therapeutic game, puppet handling, the bibliotherapy, which means discussion on a read text or writing poems, journals, stories, and the resocialization activities like trips or zootherapy. And here, speaking about zootherapy, I would like to explain that this second patient of mine who had 12 cats in her house, all these cats helped her to cope with her great loss, with her great suffering, and this was a kind of zootherapy for her. Here you have two from the paintings of the patients from that hospital. And I have to say that they were very, very successful. And many, many times with their paintings and work, they participated at a different exhibition. And finally, as a conclusion, I would like to say that homeopathic treatment quick the process of healing from traumas, treating the root of the addiction, as it happened in my cases. That is why the remedy helped them so beautifully, because it addressed not only their physical pathology and not only their alcohol addiction, but the remedy fit beautifully also on the suffering, their suffering, which was in first case the ailments from neglected being from father, and in the second case was the ailments from grief. The homeopathic treatment helps the individual to feel stronger emotionally, helps to restore the balance and harmony, facilitating the long-term improvement of physical and emotional health. It helps with symptoms of withdrawal, such as mood swings, excessive perspiration, anxiety, or depression. And another very important issue, which we could see also in that study, which was made in Holland, that homeopathy can be combined with any psychotherapy or support group. In fact, homeopathic interview often brings essential information for other therapies, because we used to make the interview very deep. So finally, I would like to say that my own definition of success is leaving your corner of the world better than you found it. Your corner may be focused on a single town or a neighborhood within a city, or it may carry you to dozens of countries. Whatever your sphere of influence, when you are seeking to enrich the lives of others through relationships, you will find the most satisfying form of success. And as I said, I am very, very happy that I can contribute it a little bit and to make the life of this kind of patients a little bit better through introducing the art therapy. So thank you very much.
Yeah.
This was my presentation.
Uh, that was an excellent presentation, ma'am. We
Thank
request
you.
participants for any doubts for ma'am, which ma'am taken just now.
Please.
Dr. Vipa, are you there?
Yes, sir. Yes, sir. I'm here.
Okay, okay.
I didn't found any question on
Okay, I
Zoom
will,
right
I
now.
will, I will look in Facebook and YouTube.
Yes, sir.
Okay.
Yes, sir.
Please.
I think people are well versed with the topic. Anybody want to talk to ma'am can raise the hand. Raise the hand. They can ask any doubts.
Yes, please. If you have questions, you can ask me. Yes, in the second case, I would like to say that I used Allen potency. Uh, I start, although I should start maybe with higher, but I start with Lackes is 30 followed by LM3 um, because she had I couldn't go higher because she presented pain. She has pain at the level of the ulcer, and that is why I keep on this low potency. But I gave her LM potency daily, and in just 6 weeks, as you can see, the evolution was beautifully. In the first case, I used 1M, Lachesis 1M.
Okay, ma'am. Uh, ma'am, ma'am, I have a doubt actually.
Yes,
So
please.
in treating the case now, we will find symptoms in different spheres, like in the mental sphere, in the general sphere, in the dreams,
Yeah.
and there are some trigger factors are also there. So I find that in alcoholic individuals, the symptoms after taking alcohol are much different. Whether that will help in individualizing any cases, or we have to keep up on the general criteria for the symptom selection.
I don't think that I understand exactly which is the question. If you have to focus on the alcoholism, or if you have to take in consideration, this was the question, or
Yeah. The question, before alcoholism or after alcohol. Some patients will sing after taking alcohol now. People will be abusive after alcohol. Some people will make quarrels now. So whether
Mhm.
that has any importance in treating the cases.
Yes, but my advice, or I don't know, my experience, or how to say, as I illustrate also with these cases, that of course they can be, I mean, their behavior will be changed by the alcohol. That is for sure. Like in my cases, that for example, the first case that he used to be he presented this traits of violence, auto-aggressivity, and things like that. But I think that it is not important to focus on this. It is very important to go deeper and to find out the reason. I mean, what is his main frustration? What is his main and for example, in first case, um, his main problem, it was in one level that he was very indecisive what to do, to marry or not to marry. But deeper as this, so he has this indecisiveness, which I demonstrate to the materia medica, that we really have in Lachesis this irresolution to marry or not to marry. But there was a very deeper cause, the suffering from his childhood, that he felt neglected by the father because he never met his father. And this is what I find so beautiful in all these cases, and in homeopathy, that through that with one single remedy we can address all his sufferings. Because you know that the fact that now he became aggressive, and now he is auto-aggressive, it is just one layer of his personality. But as I presented earlier, usually these patients who has this problem with addictions, they have a very sensitive soul. So if you can look deeper or further of their addiction, and
Okay.
a little bit to analyze that what happened in their life, which kind of sufferings, which kind of frustration they had, and why they became addicted.
Okay. Ma'am, there is
Because
a
for excuse me, because for example, in first case, in fact, he came that he had the stiffness of the left shoulder, and of course, maybe if I would not went deeper, you can treat the person only for the stiffness of the left shoulder, but this was just a layer, because after that it came very quickly the indecisiveness that what to do with his life. This was the biggest issue, that what to do now, because this girlfriend in another state, and how to go there, and that and but when I asked him about his nature and his temperament, it came out the auto-aggressiveness and things which were very, and his very intense jealousy, because he was jealous even on those mini pigs, which I find very peculiar, that how to be jealous on some animals. And um, but uh, but going back on his life story, I understand everything, and that was the beauty, that how one single remedy can cover all this. And in the second case too, because as I said, first was the ulcer on the leg, but very peculiar was this alcohol consumption, which she, of course, she does not consider that this was a problem for her, not, but it was a problem for the family. Or the 12 cats, because imagine to live in a house, and she had a husband also, so to live in a house with 12 cats is something, no?
okay, ma'am.
And okay, but beyond this was this huge suffering, because the death of her daughter, which is a very huge suffering. And this is the beauty of the remedy, that the remedy in the materia medica, we can find exactly that in Lachesis there is this ailment from death of a child. This is
Oh,
fantastic. And on the other side, how beautiful, I mean, how interesting are these polarities, you know, that she forced herself to mourn. I mean, she was wearing this black dress for 20 years, but in fact, in her soul, she has this big desire for amusement. This is another very typical symptom in Lachesis, the desire for amusement, because she was a singer before. And now just imagine how big suppression was on her soul, because now she somehow she forced herself not to sing, not to do things, and she was wear this black dress. But in fact, also this was very interesting, because finally I find out that she did this with this long black dress because she was so secretive not to show to the people that she has this ulcer. So it is fantastic how human psyche, you know, that she suppressed herself emotionally totally. Of course she has the great suffering too, because of the death of the daughter, but everything what she suppressed emotionally came out in on her physical body through the ulcer, because she had this ulcer for 15 years. In 15 years this ulcer was never healed, and now with
okay.
homeopathy, in just 5 weeks, it healed. Why? Because the remedy cover all her symptoms, not just the physical symptoms, but also the symptoms from the emotional level. And yes.
Thank you, ma'am. Ma'am, there is a doubt. How to help patients who are not willing to leave alcohol, but their close relatives come for their de-addiction. How to approach in such cases?
Well, yes, it is a good question. And usually, how to say, it is not very moral. Yeah, I think it is not very moral to treat somebody if she does not want. But the question is that so when the patient is not cooperative, then I would say that we have not how to treat. But as this patient, I mean, these two patients illustrate, the first, for example, he didn't came directly because of his alcoholism, but after his alcoholism, how to say, was obvious, he said that yes, he would like not to have this problem, I mean, not to drink daily. So he was somehow conscious. He wanted to collaborate. The second one, she does not want to quit her alcoholism, but she wanted to heal her ulcer. So, um, but when a patient does not want to do anything and just the family want, I don't think that it can be a successful treatment.
Okay.
Maybe then you have to treat the family,
There
not
is
to
a same,
suffer.
there is a same question in the pattern actually. Can we treat addiction cases without patient agreement if families agree? Can we recommend drugs if family wants? That kind of cases too. I also come up in my clinic that the patient needs treatment, but they don't want to treat for the alcoholism. But their family sometimes asks us, can we treat? And sometimes it works, sometimes it is not working for me. So people are asking whether there is any criteria like that.
Yes, I would like to say that it would be not moral to treat. I mean, not only moral, but not and not legal, because here for example, we have to have the patient agreement that yes, he want this treatment, um, and but on the other side. Okay, I am not how to say, I am not a specialist in addiction problems, so I cannot give you all the advices, but as I know, or as far as I know, this problem about addictions is really a family problem. It is not all, it does not belong only to the patient, and because I have been trained also in family therapy, so I have a few knowledges, and in this situation is really very important to treat the whole family. I mean, beside that, even if the patient would agree to follow a treatment, it is very, very important to treat the whole family, for example, with family therapy, because the family dynamic, you know, it is, um, how to say, pathological. The interaction between the members of the family usually is not exactly a healthy relationship. And that is why, yes, in most of the cases is it would be really good to treat all of the member of the family. And in this uh, I mean, because if you bring only the family member with alcohol problem, for example, to be treated, then you put all the responsibility to him, that you are ill and you are the problem. But if you reframe and you will say that it is not his problem, it is our problem, then maybe the cooperation of the patient would be better also.
Ma'am, okay, okay. I'm getting your point. Uh, so there are any questions?
Doses, about doses, division
Ah,
and
yeah, about process. Yeah.
Yes, which I already told, but I repeat. So for the first case, I gave Lachesis 1M. And for the second, I started with Lachesis 30 and followed with LM3 daily.
okay. So in first case, how many doses you given, ma'am? I thought question is regarding that.
Yeah, I gave him a single dose, and on the follow up after 3 weeks, the result was so good. I think I repeat one more time, but just with 2 doses, he was practically cured.
Okay.
Okay. Okay, ma'am. I think it's for now actually. So can we conclude this session, ma'am?
If if
Can,
we
can we can we conclude the session?
Yes, yes. Thank you very
Okay.
much. Thank
Yeah.
you.
Ma'am, it was a wonderful session, and we are really happy that you came for us too. I have seen your Ahasia webinar last month, and I approached Dr. Vibha and Dr. Divishri also was there. So I used to attend your programs actually. So thank you so much for accepting the invitation, and thanks to Dr. Vibha for arranging such a webinar for us. And I thank my team, my main member, Dr. Wimble. She's doing the technical aspects of these webinars. And my team, IHMA Peravam, and some of my colleagues are there. And I thank all of them. And I thank all the doctors who joined us in Zoom, Facebook, and YouTube. We will come up in next week, and thank you so much once again. And
Thank you
thank you.
very much for everybody, for Dr. Viba, you, and all the organizers from EHMA. Thank you very much. It is a great honor for me. So thank you. Thanks a lot. Bye.
Bye.